Hello, welcome everybody to today's webinar, Closing Care Gaps in Cardiology with ALYKA Health. We're just going to give another minute or two for the audience to join the webinar and get connected. Be waiting patiently for another minute or so. Okay, looks like we have the attendees on the line. So we will go ahead and get started on today's presentation. I am happy to welcome you to today's presentation. I'm so glad you could join us. Closing Care Gaps in Cardiology, Prevention, Digital Tools, and Practical Strategies is what we will be covering today. We're going to start with a couple of housekeeping items. First, you should see at the bottom of your screen two main buttons. The chat button is where you will find a link to download the slides from today's presentation. We will send this link periodically just because it doesn't show up if you haven't already joined the webinar. So as we see people join, we will be updating that link and sending it through the chat box. The Q&A box or button is where we encourage you to pose your questions to our presenters. We will be doing audience questions at the end of the webinar. So please go ahead and type your questions in that Q&A box, and our presenters will be speaking to those and answering those questions at the end of the webinar. All audience members will be muted and off camera. So again, that typing your questions are going to be the best approach to connect with our presenters. Okay, so today's presentation is going to be Closing Care Gaps in Cardiology, Prevention, Digital Tools, and Practical Strategies. As many of you know, cardiovascular care teams continue to face a persistent challenge, closing the gaps that lead to avoidable hospitalizations, poor medication adherence, and fragmented care, all while striving to deliver more value in an increasingly lean environment. So today's session will explore how prevention and early intervention can reduce cardiovascular events and how digital innovation can extend the care team beyond the clinic walls to support patients continuously, improve coordination, and ultimately drive better outcomes. We're especially excited to host this discussion with ALYKA Health, one of Minaxim's newest industry partners. ALYKA's patient-centered platform brings together clinical data, wearable insights, and behavioral science to empower both patients and care teams. And behind this work are two visionary physician leaders who help shape ALYKA's mission and bring deep clinical experience to its design. Dr. Ali Rahimi, Chief Executive Officer and founder of ALYKA Health, brings extensive experience as both a clinician and innovator focused on using data and digital engagement to close gaps in chronic disease care. Joining him is Dr. Amit Thosani, Chief Medical Officer at ALYKA Health, who has deep expertise in electrophysiology and the integration of technology into cardiovascular practice. Together, they'll share insights on how digital solutions like ALYKA's can strengthen prevention strategies, improve care management, and align with value-based goals. With that, let's dive in. Dr. Rahimi and Dr. Thosani, thank you for being here. I'll hand it over to you.
Thank you, Claudia. It's a pleasure to join you, your team. Look forward to this opportunity to diving in. As a cardiologist practicing now close to 20 years, seeing great opportunity where the medicine that we practice day to day is prime for improving value. We recognize that the U.S. healthcare system is shifting fast from fees for service to a value-based reimbursement model. For cardiovascular care, this shift is not just a policy change, it's a financial and clinical tipping point. Here's some quick stats as to why. The pure economic weight of cardiovascular disease, the cost currently right around $378 billion annually. It's projected to go over $1 trillion by the year 2035. Cardiovascular disease, the prevalence, almost 1 in 2 adults will have some form of heart disease. So today that sets us close to over 127 million Americans living with heart disease. But yet the opportunity is that it's preventable. We recognize that 80% of premature heart disease and stroke could be avoided through lifestyle changes and better management. And there's this recognition in value-based care that the priorities are high because it is preventable, because it's such a significant burden. And for that, policy changes, as we know, there are penalties that are coming out in existence. Why? Because when you look at heart failure, for example, the readmission rate is high as 25%. How can we do better? And there are these rather incentivizing us in reverse ways as to how we can bring down this this disease burden that's affecting our country. Next.
Yeah, thanks, Ali. And I'd like to echo Ali's sentiments, Claudia and MedAxiom team. It's a pleasure to be here today. And thank you for having us talk about this very important topic. And, as a practicing physician, this is one of many examples that we see of a patient, same patient, 2 different chest x-ray films that you're seeing on the left is normal, on the right is a patient in heart failure because of forgetting to take medications, not understanding their value. My blood pressure was okay. I didn't feel like I needed those medications anymore. And lo and behold, of course, wound up in decompensated heart failure and in the hospital. And I think as physicians, we treat these sorts of events at the time of the need for acute care. But I think the opportunity that both Ali and I and many practicing physicians see is, can we do better to engage and educate our patients, and I dare say activate our patients and help them become part of their care strategy. And I think that's one of the missing pieces today in healthcare, and one of the problems for which we're trying to solve. Next slide, please.
So when we get into the details, trying to better understand value-based care and the shift towards this, critically important for cardiology. As we alluded to, the prevalence is high, but yet it's preventable. So the math is simple. Prevention and early intervention are no longer nice to have. They're survival strategies, not only most importantly for our patients, but for our clinical practices. We know through the literature, aggressive prevention could cut coronary heart disease incidence by over 63% over the next 30 years. But there's a challenge. The current traditional models don't scale prevention efficiently or personalize it effectively, nor are we rewarded for it. So what is the opportunity? We recognize that with the advent of the iPhone and technology and wearables, the portability of data, that these digital health tools can bring together these data points. The use of behavioral science to modify and improve the primordial prevention of those behaviors that can lead to heart disease. And then bring in patient-centered design. How do we elevate that care experience in designing for our patients so that we can deliver that proactive, personalized engagement where they are, meeting them at the point of convenience for them, 24/7, 365 days a year. We must and can do better in elevating the care experience in healthcare. And oftentimes, I believe we've taken our patients for granted. We expect that they need to say yes. They don't have any other choice, but they do, because there are centers of excellence that are doing it better. So how do we identify those care gaps upstream by empowering our patients, making them part of their care, and an extension really of the care experience goes outside the walls of the office so that we can manage conditions before they escalate. And ultimately, we want to improve the quality of care, the health outcomes, and reducing avoidable readmissions and improving various quality metrics, but doing this at scale, at a population level, and doing it operationally in a lean manner. So ultimately in cardiovascular medicine, that means making primordial to secondary prevention a priority and profitable. Next slide.
And I think the exciting part about this is that prevention isn't just what's right for people, it's also good business. And I think that synergy is really the opportunity that we're excited about. That same patient we just discussed in a fee-for-service world, great, your hospital gets more revenue because there's an admission, but that's not the point, right? None of us want our loved ones to be admitted. In a value-based world, we want the outcomes to be better. And we're starting to see that alignment and incentives to make that part of the conversation instead of one that's based on volume alone. And the data that we're seeing now is compelling. Providers in value-based arrangements see significant savings in lower total cost of care to patients. It sort of is self-sustaining through the entire ecosystem of the healthcare system, and that's the opportunity that we have here with digital health to be lean and scalable. And I don't think that anyone would be upset with seeing fewer admissions and ER use, unnecessary testing, and reduction in costs. And I think this is a huge opportunity that we have that we're excited to provide a solution for as part of our discussion today. Next slide, please.
So we, ultimately look at it is there are care gaps. We see our patients maybe a couple times a year, and those gaps are compounded. So really the takeaway is that prevention, early intervention does not just save lives, but in today's marketplace, it's a competitive advantage where we are elevating the care experience and ultimately improving outcomes by moving care well upstream. So again, in value-based care, the real return on investment is measured in clinical outcomes to our patients and our community. And we just have to ask ourselves across the board, from small independent practices to very large cardiovascular service lines in health systems, let's examine our current tools, our workflows. What is our engagement strategy? Is it a plain black and white after visit summary? And we hope our patients follow up and take their medicines, and we see them back in 3 to 6 months or a year. How do we capture that value? Or are we still playing by the old rules? And what is cardiovascular care that's patient-centered, that's designed for the best outcomes, that again, we can execute in an operationally lean and scalable manner.
So succeeding as a cardiologist or in cardiovascular medicine means rethinking how we deliver care. And here's sort of the essential things that we think about is one, we know from basic data who's at risk. We know who those higher risk patients are and who may benefit from being activated upstream and early to prevent the inevitable hospitalizations, complications, need for procedures, surgeries, et cetera, many of which are avoidable. Healthcare is a team-based sport. I think this is not news to anyone. And we have to move beyond the physician being the rate limiting step to unlock that patient's care to a more multidisciplinary team, not only of healthcare providers, but frankly, I would add the patient to that model as well. Best practice guidelines can be standardized. And I think care standardization leads to better quality, number one, and also identification of deviation. And that's an important part to the way that I think the future of medicine will be engineered. Care coordination to connect the fragmentation and multiple steps that the patient experiences in his or her journey. And then, of course, fortunately, a lot of these incentives are starting to align so that we are truly talking about value and not just volume. Okay, and I think these are the things that all of us are thinking through in our own organizations as we try to do better for our patients. Next slide, please.
So many of the points that Amit touched on, the fundamentals of delivering better care, many systems are employing that. And, this is a recent study that was done in the Lancet. And just looking at the current state of care that's provided by physicians and that by healthcare managers. So healthcare is a team. no doubt, and every person plays a critical role, from our frontline nurses and assistants to our care managers, our pharmacists, nutritionists, coaches, transitional care managers, complex case managers, many folks along the patient journey, and lots of human touch. But when we take a step back at this and looking at care, the advent of technology, particularly digital health, and where it's going, we look at this care model with where the expenditures are heading and ask ourselves this question: is this lean and scalable when we're looking at the number of human touches? No doubt, again, each person plays a role here, but how do we cinch into care that's more readily available, more efficient, and generating better outcomes?
And so the question is, of course, with all that as a background, how do we bridge that gap between office visits with digital heart health tools that integrate key elements from the EHR, from wearables and devices that are now ubiquitous, and from self-reported and patient-reported data? And how do we use that to deliver personalized guidance and education that's available 24/7, 365 days a year, as opposed to the few times that you see your physician and are sort of in between visits left on your own to figure out your way? And we think the key here is to keep patients engaged in their care plan every day, not just in the exam room, not just in the walls of the clinic, not just when they're hospitalized, not just when they're having a procedure or a surgical intervention. And in the future, we think that the winners in cardiovascular medicine will be the ones who can scale this personalization, coordination, prevention simultaneously. Next slide, please.
So, as part of the mandate with MedAxiom, and why we're so excited to be a part of this community, is to genuinely work together to transform cardiovascular care. We want to achieve the optimal care experience, and we believe that ultimately the success hinges on what happens between office visits. Again, we see our patients just a couple times a year, even with the support of our staff and team. There's more days that we can engage them, empower them, and extend our clinical reach, improve the patient touch points, so that we can turn passive data, passive interventions to proactive, prevention and care gap closure. There's a study, many studies have been done, but when you look at a meta-analysis was published, recently, that looked at over 35 studies of digital cardiovascular intervention. So this is not something new. Many folks have been, taking this up, whether it started with, remote, monitoring, whether it's blood pressure, using scales for weight, now wearable information. Also now with the advent of these different digital health tools that help modify behavior, improve medication taking, but ultimately, the results are going in a very positive and encouraging way. We're seeing fewer cardiovascular related hospitalizations, improved med adherence. Again, in healthcare today, particularly in cardiology, there's not a diagnostic or treatment dilemma. We've got the medicines. We have to help our patients adhere to those treatment plans. We've got cardiac rehab. We know the outcomes are great, particularly for our patients post-MI, post certain procedures, and improve that completion rate. Hypertension control, the number one driver for heart failure hospitalizations. We need to improve the blood pressure so we can remove and unload the heart, so improve blood pressure control. And also another risk factor is cholesterol. So again, overall, the studies are demonstrating positive outcomes for those who adopt some form of digital health.
The good news is that you don't have to figure this out, in a vacuum. There's sort of key traits that are shared among solutions that work and among systems that are doing this well. These are a few of them here. So, early detection of a problem, in the heart failure space, shown to be benefit. In the arrhythmia space with wearables, they're shown to be benefit. Is important to prevention and prevent that acute care episode need as best as possible. Personalizing education with patient-specific guidance to help our patients, our the people that we're here to care for, understand what it is about their healthcare, their conditions, so that they can be an active participant in their care journeys. Behavioral change support. There are evidence-based techniques for promoting behavioral change that deliver clear improvements in risk factors and risk factor modification. Medication management and adherence. Digital tools that improve adherence show significant benefits through reminders and streamlined communication. And integrating with clinical workflows, cutting clinician burden, which is obviously top of mind, I think, for a lot of us in practice, and lift quality and performance by significant amounts. So the key here, I think, is that digital health isn't a sideshow anymore. It's the engine to power better outcomes, lower costs, and really affect patient engagement in a value-based era. And I think it's exciting that we're here, and the ubiquity of technology we can leverage for better outcomes and better care. Next slide, please.
So, another point is, this financial impact, healthcare in all the challenges, from an operational standpoint and the human resource intents and all the different variables, some at our control and some not. It is a business, and it's something that has to be managed well. And in the future of cardiovascular care, failing to adapt to the latest technologies and methods and processes is a business risk. So this is not just a clinical one. And the shift towards value-based reimbursement is rewriting the playbook. And I think the reality is the margins are shrinking. We want to maintain market share, demonstrate to the community that our practices are leading edge, are elevating the care experience, are generating better outcomes. And there are hard costs associated with standing still, whether it be payment penalties that are happening, the cuts in physician reimbursement, the challenges that were being faced really with market share erosion. But the good news is those who are successful in value-based cardiovascular programs, they gain market share faster than fee-for-service heavy competitors. And again, we have been talking to patients and seeing the outcomes. It's better care experience longitudinally, better quality and higher satisfaction. So again, no one wants to compete, be a laggard, and you want to advance the priorities for your practice, and ultimately you'll see higher revenue as well. So again, from a business standpoint, it makes sense.
So with that as the stage, the opportunity is clear. It's, prevention and early intervention aren't just clinically right, but doing what's right for people is also financially rewarded, which makes this whole thing sort of virtual sustainable cycle. And by employing these sorts of strategies that we discussed, team-based care, risk stratification, standardizing care pathways, digital engagement tools, we can align outcomes and economics. And the market's not going to wait for us. This is already happening. It's expanding rapidly. It's not a question of if, but how fast we're going to take this on. And so, one of the questions that we've thought through is what's going to be our next move in our practices to protect, I'd say, our patients and our margins. Are we going to do that well, or are we going to put both at risk? Next slide, please.
So we've been really, Amit and I and many in our community have been looking at, what does the future of personal care look like? As we've been looking at the evolution of digital technology, of wearables, of devices, the portability of patient data. We took a step back and said, what if we can create a personal heart health advisor that integrates, multi-layers of health data in real time and makes that data actionable, dynamic, and at the fingertips of our patients, of our community, that links it to the latest science-based evidence in an environment that's trusted, that's secure, free of advertising, so that we can ultimately improve health outcomes. So we've been now working on this for the past 5 years, working with patients, working with our community to figure this out.
And here's the foundation of our solution. So the 3 layers of data Ali just mentioned involve self-reported. Key elements of the electronic health record, those key things that we believe as care providers are important for our patients to understand and manage to. And then, of course, data from devices, blood pressure, heart rate, rhythm, et cetera. And you'll see at the center of the Venn diagram is where we sit. And we take those elements, integrate smart AI, personalize goals and insights directed individually to each patient that overlie or are underlied by scientific guidelines. And the approach here is all driven to improve our patient experience, engagement, and ultimately outcomes.
So in part of this journey of design, we wanted our patients to be front and center. And so we looked at what they're using, what are the social media applications that they go to. Speaking with my father, who's 82 years old, and, looking at his social media use, looking at our patients and speaking with them, the entertainment apps or the sporting apps or the gaming apps, what keeps them coming back? And can we create a form of digital health entertainment, if you will, an application that is engaging, empowering, with its soft, empathetic tone, but yet has the data behind it. It knows it's their medications and their lab results, and it makes it dynamic and actionable, bringing in real-time insights and honing in on those vitals. What would your dashboard look like for your weight, your blood pressure, your sugar, your steps, your daily activity, heart rate, sleep? What is your risk of having a heart attack over the next 10 years? And placing that in a format that's clear, visible to them. It's not on a computer that's facing me as the cardiologist, but rather that is front and center for them in a single interface.
And so this concept of entertainment, I think, is an interesting one that we've studied quite extensively. And here's the truth: dealing with your healthcare is not fun, right? If you get a lab result and it shows up in red on a screen, you don't want to deal with that. It's not fun. We have to make this engaging, and the tone has to be right. It has to be something that people want to interact with daily. And we've seen, plenty of examples of technology that don't affect your health, that are, quite sticky as far as use, daily use. And we've studied all that, and you'll see some examples here of what we have done our best to design in what we believe is an elegant, user-friendly, interactive, multimedia format that provides a daily journey for our patients to address those key factors between their visits with us, so that when I ask our patients, my patients, hey, listen, we need to work on your risk factors, including your weight and your diabetes and blood pressure. What am I doing about it between their visits? I'm not, right? I'm not seeing them. But we, I think, provide the right tools to be able to manage to those things day to day between those visits. And we think that there's value to that, so that the next time when they come back, we've made progress in each of those domains.
And when we think about this, there is a defined role for each of us on the team in what we're doing, but ultimately we need to extend beyond the walls of our offices, and even more so than the remote monitoring or the coaching or the human touch points that we can offer, such that, what is that digital extension of our care team that they are using? So we're not losing them to some social media influencer or to a Google search ad, and that tells them that they don't need to take their statin anymore, even though they may have had a heart attack recently, or that now folks are looking on ChatGPT for their answers. So again, sending folks home with an application that is part of our team that can continue risk factor management, that can provide personalized goals and insights on those risk factors that we know will affect their heart health, if not tended to on a daily basis. Chronic care management. How can we be a partner and an adjunct to our practices, CCM pathways, so that when we are speaking with our patients over the phone as part of their care management, they can open up an application and we ask them about, have you seen the coronary artery disease module or the AFib module? I had one of our users that we were interviewing recently said, for the first time after 10 years of dealing with atrial fibrillation, she now fully understands her disease. She understands the symptoms, how it's diagnosed, the treatment, understands, what it means to have a cardioversion, and how she's had it appreciating that, yes, my doctor or provider only has 15 minutes in the room, but this application has now, brought everything front and center in my hands and has improved my understanding. And then ultimately what we want to do is, improve that care experience, move upstream care gap closure, and this simple reminders, whether it's their annual visits, their follow-ups, the preventive screenings. How many folks do we lose to follow-up when the return office visit is more than 3 months? If they have to come back 4, 6 months, 9 months, a year, imaging follow-ups, serial imaging that needs to happen for significant valvular heart disease. How can we do better? So to improve that patient satisfaction, and this is one of those pathways.
So here's our the opportunity, and what we've seen in our experience early with our solution is that we've been able to elevate patient engagement and education, and that's by activating our users with goal setting, self-tracking, and directed educational content, seeing 71% in-app engagement, supporting population health, providing real-time data, or seeing real-time data for deeper insights to stratify higher risk groups and identify care gap closure opportunities across populations. And of course, this has a large return on investment. We're seeing here 8.5 to 1. Improving quality and outcomes, which is really what it's all about. We're seeing early 10% improvement in blood pressure, LDL, and A1C. And of course, while doing this, lowering practice costs, shifting some of that burden on those human resources to a digital member of the care team to help guide the patient's care journey. Reducing that support time, phone calls, all those things that are becoming more and more challenging in all of our practices.
Dr. Rahimi, Dr. Thosani, thank you so much for that overview. Really love to see your use of existing behavioral patterns and entertainment to drive that patient engagement. I think those are really, that's the care gap we're all working to fill, all while keeping it sustainable for clinicians and health systems. And you guys have shown that to us, the return on investment and how this is better for patients and health systems alike. So thank you for that presentation. I'd like to go ahead and start a conversation, a panel discussion. We can dig a little bit deeper on this. I do want to take a moment and let the audience know, remind the audience that we encourage your questions to our panelists. There is a Q&A button at the bottom of your screen. please go ahead and click on that Q&A button, and it will open a box where you can type in your question. We will be watching for those questions and answering them live at the end of this discussion. So I'll get started, if that's okay, on starting with the challenge. We know cardiovascular disease is our most prevalent and our most costly condition. So from your perspective, what's still missing in how we approach prevention and early intervention today at scale? Dr. Rahimi, I'll start with you.
Sure. We think about this often. We're with the best of training and the experiences that we have, at the end, we're sitting in the office and we're still seeing people present with heart attacks, with heart failure. And it's not their first one. Recurrent heart attacks, recurrent heart failure, needing more procedures. Just our reach is limited. But yet the margins are growing thinner. The ask of us is greater. And so we look at it, we're not faced with a diagnostic dilemma. We can diagnose heart disease. We can diagnose hypertension, hyperlipidemia, diabetes. We have the drugs and the treatment for them, but we need help. And I think we need to flip the pyramid. There's more patients than there is us. And if we can find the right way of supporting them through a digital, tool, we can empower them. And there's this patient empowerment opportunity, patient engagement opportunity, where we can, enlist them in their own care, but that's evidence-based, that's centered and designed for them.
There's an element of psychology in taking care of the patient, so absolutely. Dr. Thosani, anything to add?
Yeah, I think that when we thought through the solution, we tried to design to something that we want in our own practices. It's the missing piece, I think, to what exists now. And I'll tell you, I'm a subspecialty cardiologist. I operate for a living, and I am trying to put myself out of business. There's a lot that can be prevented. There's a lot that is, I think, challenging to scale. Ali's heard me say this many times. I have only two hands. There's only so much you can scale. We have the tools available. And I think the notion that patients are not interested in being active participants in their care is not a fair notion. I think that the burden on us is to provide the solutions for them to want to be active members of their care, number one. Okay, and I think that we're going to see, my opinion, a difference in what people expect from care solutions. The same way that if you want to understand your financial information, you're not going to tolerate making an appointment and driving to the bank and waiting in a waiting room and seeing a financial executive and having your information opened up, which is not yours or not understandable, and then closed up, and then you go on your way and you live your life and you try to figure out how to make sense of all this in the midst of your busy life. It's the same sort of analogy that I think where we are right now in healthcare. And I don't think we're going to tolerate that as a population, if not already now, then in the very near future.
Wonderful. That takes me to the shift to value-based care. We are all experiencing that and driving towards that shift. How do you see that changing the conversation around the more we adopt value-based care? How do you see that changing the conversation around prevention, coordination of care, accountability, outcomes?
It's a great thing. We know there are models out there that do it very well. Value-based care is not something new. There are systems, again, that when you look at large health systems that have kind of operationalized value-based care, they've been working in that environment. How do we learn from them? How do we learn from them at our own scale, and deploy that? And I think this is going to help accelerate that. This will be good for our country. When I was getting my inpatient health policy, our healthcare expenditures was under $1 trillion. It was still 800 billion. We were using a B next to that number, 12% of GDP. We're closing in on 20% GDP. 5 trillion in healthcare expenditures. In the future, it's going to hit 7 trillion. So value-based care is needed. It's necessary, and it'll be good for our patients and our practices.
Dr. Thosani, anything to add there?
I think that all of us are interested in the concept of value-based care. And what I think about when I think about value-based care, it's valuing the things that matter to our patients, matter to our family members, right? We're starting to see that being operationalized now. And I think it's exciting that we're not just talking about volume. Okay. You can provide large volume, terrible care. No one's interested in that, right? It's about patients and their outcomes. And I think the fact that these things are synergistic and becoming more aligned means that wherever you are in the value-based care spectrum, you may still think of yourself as a fee-for-service practice or provider, but I would say there are elements of value-based care all through healthcare. I think as those things become more to the forefront, when we start shifting the conversation away from just volume-based growth into those things that actually matter to patients, I think it's an exciting time for us.
Going back to that operation, how do we operationalize value-based care, I think is where the majority of the questions lie still. So that's where a digital tool like yours and can come in and fill some of those gaps. And these tools are always described as an extension of the care team. How do you see that playing out in a day-to-day, in a cardiology practice? Either end.
Good.
Yeah, I think where we're at right now that this has matured as a technology, and with the focus on our patients, we should be promoting it as an adjunct to the current therapies that we have. So you send a patient home and they're on average 5 to 7 chronic medications, blood pressure medicines, diabetes medicines, heart failure medicines. They're on a diuretic, and we prescribe that. They're on blood thinners, and we, in the after visit summary, it's listed out. And then when they come back, we reaffirm, are you taking your medicines? When we reach out with our PharmDs or our chronic care managers, we ask them to go through their list of medicines. We should do the same for digital health tools. We need to promote them as a side-by-side adjunct to their current therapies. It is not a black and white after visit summary. It's not a Mediterranean diet booklet or plant-based diet that we run out of in clinic and wait for it to come back in back order. It's not losing them to another clinic's website and losing that branding and losing that affinity. So can we have a co-branded digital health application that they go home with that is an adjunct to their current therapies?
Like a prescription.
Exactly. I think if we don't manage those day-to-day opportunities, what we'll see is every 3, 6, 9 months during their follow-up, we're not making progress. Mm-hmm. And we're offering treatments that are preventable. There was a recent JACC paper showing that more than 90% of heart disease has a preventable risk factor. Right. And I think very few people would argue with the fact that, hey, listen, I'd rather have a heart attack than prevent it. I don't think anyone says that. I think we have to just empower people and find the right tools to make that at the forefront.
I couldn't agree more. Going into what brought you to develop ALYKA Health and Heart Health Advisor, you were, Dr. Rahimi, you were a physician experiencing these same care gaps. What moments or patient experiences made you realize there had to be a better way? I'll start with you, Dr. Rahimi, but I'd love to hear your perspective as well, Dr. Thosani.
Yeah. One of my mentors, is an esteemed preventive cardiologist. Another one of my mentors is a world-renowned outcomes researcher in cardiovascular care. And kind of marrying the two about how do we scale prevention to improve outcomes. And that's been a professional mission of mine. And, what brought me to the current system that I'm at, oversaw cardiovascular quality and performance improvement for many years, but yet looking to see how do we take what we do well in our system and make it scalable and lean? How do you spread prevention to the masses? So I love taking care of my patients. I see, 15 to 20 patients a day, but how about if we can help millions and across, different borders, different languages, and we scale it, and that we can say we truly are preventing heart attacks and heart failure, and folks are living longer. And, the folks that I see that lose a parent early to premature heart disease, we know it can be prevented. And I know Amit has many experiences with folks that have preventable sudden death.
Yeah, Claudia, it's a great question. And it gets to our why, right? We're both very busy, as are all the people on this call. Why? Because this is personal to us. Because we've chosen to spend our lives caring for others, and we're all patients. We're on borrowed time, but we're all patients, right? And I think that, from my standpoint, I'm fortunate to have a friend like Ali who's given his life to prevention, and professionally, I have not. I'm a subspecialty person who's interested at this stage of my career in prevention as much as I'm interested in that subspecialty care, or even more, because so much of what we deal with is absolutely preventable. And I think that it's great that we have these new great technologies to do all this type of procedural work and care. But if it's your family member, and I could have done something more to prevent their needing my surgical services, that's the kind of care I'd want for my loved one, right? And I think it shifts the conversation to something that one of my mentors told me once, which is this: you're a human being before you're an internist, before you're a cardiologist, before you're a subspecialty cardiologist. And for me, it's paying it back now. Midway through my career, mid to upper way through my career now, there's a better way to do things for people. And I think that we talk about this in broad strokes and population level, but frankly, when it's your loved one, it's a whole different situation. And I don't want you and the people on this call having to experience these sorts of things that I deal with day to day for your loved ones that we deal with in the acute care setting. Let's prevent those things from happening as best we can. We can't prevent all of it, but we can do better than we're doing.
So much of this is all around keeping the connection with the patient so that they understand their disease, they understand their treatment, and they can follow it through for better outcomes. Many times, or sometimes, digital tools feel a little impersonal. And I see that you two have developed this tool to do the exact opposite. How do you maintain that human connection, Dr. Thosani? I heard you talk about being a human. How do you maintain that human connection in the design of this tool? I'll start with you, and then Dr. Rahimi, of course, I'd love to hear your follow-up.
Thank you, Claudia, for this question. This is something we actually have spent a ton of time thinking through, not just ourselves, but our bigger team at ALYKA. And I think as a first step, a lot of healthcare resulting reporting is negative, right? And I would say one more step beyond that, it's great that people have access to their health data and information. There's portals, there's EHRs, but that information given out of context, frankly, is a disservice to people. It causes tons of anxiety. It causes tons of phone calls. And yes, it's important that, as a patient, that you have access to your health records. I agree with that, but you need to have access in the right context. And what we're trying to do is provide that right context. We don't want you searching all over the place to figure out what this statin medication is for. It should be right there. Learn more. It's right there in our app. You can click on that button and figure out, why am I taking this? What is it for? Is it important that I still take it? Have I taken it? Did I take it today? Did I take it yesterday? I can't remember. Well, we help you with all that type of management. And I think number two, listen, if things are not going the right way, I mentioned this earlier, I don't want to see a red flashing number on a screen. I don't want to deal with it. It's not enjoyable to deal with, right? And I think that's one of the challenges that we have in healthcare. It's this pejorative approach. And that's not the point. We're all on a journey. And we've been very careful about how we message these daily reminders to make it, as best as possible, something you want to interact with for the greater goal that you're trying to get to. And, I think that the conversation and the design that we're seeing across other industries is something we can learn from. And it's got to be more positive and it's got to be more enjoyable. And this word entertainment, I think, is an important one, because you're not entertained by being put down and being made to feel bad about where you are. It's a journey. It takes time. It takes perseverance. It takes care. And that's what we're trying to do.
Beautiful. Dr. Rahimi?
Yeah, Amit said it very well. And I think, to add to that only is that this is a continuous journey on our end too. The product continues to be refined. We continue to engage members and users to understand their needs. What are our gaps? We recognize that folks don't want to read a 900-word blog. Then we dropped it to 550 words. That wasn't it either. But not until we got to 300, 325 words at a 6th grade reading level, written in an empathetic tone, non-judgmental. People, loved it. They engaged with it. And then, again, listening intently to our patients. And that's how, all of us are going to do better, both in the office and outside the office. And, how do we create this seamless, delightful experience? We see it in the hospitality industry. When you enter some hotels or whatnot, we can do this in healthcare. We 100% can do it, and no one deserves it more so than our patients and their families.
Here. We have 9 minutes, but that would have been a great closing remark. We'll come back to that. I do have one or two more questions here. You shared a lot of early results, ROI, feedback that you've seen from patients and care teams. What gives you the most optimism about the next phase of cardiovascular prevention?
I would say it's the engagement. Our patients want this. They're looking for this. We need to fill that gap. We need to be the proponents of providing them the right resource. Our practices need to go paperless. It's good for the environment. It's good for the bottom line. And then provide them with a resource. I had a patient that came and said, yeah, I stopped taking my cholesterol medicine. And I said, well, how so? Why? He says, well, I was on this social media application. There was this influencer. He's a doctor, and said, if I just drink apple cider vinegar every day, my arteries will open up and I'll be just fine. So I just stopped taking it. Well, we just put 3 stents in this gentleman just under 3 months ago. So, folks are looking for answers, and we need to meet them where they are in an engaging manner, and something that's trusted, evidence-based, no advertising, no marketing. And that's the way that's the way we get there together.
So well said. Dr. Thosani?
I'm guilty of being involved with this effort selfishly, because it's something I want for my own patients in my own practice. And so I think that's been the spirit of the design, the effort. Frankly, Ali has founded and led this effort, and is just an unrelenting patient care advocate. And I want all of you to have him as a physician, but you can't, because he's only one person. But he can affect millions and millions of people, and he's given his life to this. And I think that's the part to this that I think is most exciting, is that there are people like Ali that care about this enough to, take on this monumental effort to really ask some basic questions about why are we doing things the way we do them. There's a better way. And I'm not just going to talk about it. I'm going to show it to you. And I think that's the exciting part about what we're trying to do.
And designing the solution with the patient in mind. It's so easy to design a solution to solve your own challenges, but this is really meeting the patients where they are and how they interact with their devices and softwares and all that. So I think it's a very, very smart approach. I'm very thankful for this presentation. I do have one audience question I'd like to make sure we pose here. and it's from a practice that doesn't do a whole lot of value-based care. So how would this work for them?
Yeah, I would say to really the majority of practices that are not in value-based care, that this is part of what's next. It's not necessarily the next echo machine or the next imaging modality or the next valve that we can place in folks. We can move that upstream in between visits where they have greater affinity to our practice. They generally know that we care about them. And I think, when we send our patients home with just a piece of paper that gets put on their coffee table or whatnot, is a disservice. And we lose our patients. And I think, folks are, coming up and saying, I'm looking for a better experience. I'm looking for a care team that really cares for me. And I think that's the opportunity by adopting this type of technology and moving the practice up and forward.
It's a great way to start implementing a full value-based care strategy.
And I'd add to that all of us in practice, in leadership in our practices, have to think about our care team members. This is hard work. Healthcare is not easy. It's not getting easier, right? And I think that there are very few people in the practice of healthcare who don't want to provide the best care they can to our patients. I think that's our common bonds. And I think that if we can help and do a better job with some of those basic questions about what is my disease process? Why is this important? Why am I on this medication? Am I doing this correctly? Am I moving forward in my goals? We're hoping that our solution helps with that, to be able to offload the practice so that you can see that next patient that otherwise you would not be able to see, because you're dealing with this level of stuff that occupies space and time, and there's only so many of us, right? We have to find a better way.
Extending the reach of that care team, we have to do that. And it does take a mix of technology, prevention, patient engagement. So thank you. This was a great presentation, and thank you for your insights and sharing your experience with us today. We are going to close out the webinar now. I do want to thank the audience as well for joining today. If you have any additional questions for ALYKA, for Dr. Rahimi or Dr. Thosani, please don't hesitate to reach out to MedAxiom. We will be sending an email to you all after this presentation with a way to download the slides. Thank you, ALYKA. We're thrilled to partner with you, and thank you for your insights today. We appreciate you.
Thank you, Claudia.
Thank you, Claudia.